Hi guys, welcome back to Best of Birth Worlds. My name is Kayla and I am your host today. I wanted to talk about inductions today, and that means everything from natural induction techniques to medical inductions, and that is both medical and elective inductions. So let's discuss inductions today. There are so many natural induction techniques that a lot of people talk about, but a lot of people don't talk about them at all. You know, the old ones like eating spicy food and sex, all of those kinds of things. But also there's a membrane sweep, there's all these other things, and so let's discuss what they are and how to go about them. One thing I wanted to get out there is that I will not be discussing the castor oil or midwives brew. Those are two things that you should really just be talking to your doctor about, because they can affect your baby and they can affect you. So discuss with your doctor always before doing any of these. This is not medical advice, just a little disclaimer. So let's discuss the more natural ones, and I would really like to start with the birthing ball. Birthing balls are amazing, and this is not an induction technique, but it can help with getting that baby pressed firmly on your cervix, which is really how you dilate. So the birthing ball is a really great tool to have. If you don't have one, just go onto the internet and you can find one. I found mine on Amazon. You can look up all the ways that you can measure yourself, so it really depends on your height and all that kind of stuff. So but a birthing ball is really great. You can do hip circles that really moves your hips in ways that can get your baby down into your pelvis and engaged in your pelvis. So that's why I really like the birthing ball for that. You can also help with pelvic pain. I had SPD, which is literally the splitting of your pelvic bone. If you didn't know, you can have SPD during your pregnancy, which is just the splitting of your pelvic bone. So what happens during pregnancy is your body can release relaxin, which essentially just relaxes all of your joints and everything like that, so your baby can actually grow. But also one side effect of that is that it can release too much and it can cause your pelvic bone to split. So it's kind of self-explanatory as to what that feels like, But I loved using the birthing ball for that. It was really nice to just kind of lay on, do some lunges on, just kind of stretching and just feeling really good in the birthing ball positions is really great. I know a lot of people make the joke about jumping on the birthing ball, and it's not really jumping. It is hip circles and all the things to get your hips to move and wiggle and try to get your baby down in that right position. Next, there are the old wives' tales. These are the ones that you've always heard, how to induce labor, like eating spicy food, having sex, going for a walk, all those kinds of things. There's not really a lot of evidence to say that spicy food and stuff like that is going to actually put you into labor. It's mostly anecdotal evidence that it does. There is a little bit of evidence about sex though, because if the man, has all those juices in there, I'm not sure what I can say on the podcast, but there is something in those juices that will help soften the cervix. So it can help with effacement, but not necessarily dilation. And walking is obviously just good in general, but it's not going to put you into labor. And onto walking, there are things such as curb walking. These are actually really great. I love these because they also kind of do the same thing that a birthing ball does. It helps your pelvis. It helps your pelvis, it helps your hips kind of get that baby into the right position. So I really like curb walking, doing all those kinds of things. Now let's discuss medical inductions. So these are inductions where you go into the hospital and they hook you up to all these things and they try to put you into labor. This is when you are not in labor yet, and this is when they either have to get the baby out or you want to get the baby out. So let's talk first about what medical inductions are. Medical inductions are anything medically that is going on with you or the baby that might indicate that the baby needs to be out earth side quicker, that is safer outside than inside. Elective inductions, however, are essentially just there's nothing going on, there's no medical reasons, and you just want to be done with pregnancy. You don't want to go through pregnancy anymore, and you just want to be induced. That is what an elective induction is. But they both go through the same amount of steps to be able to induce your baby. So let's take you through what an induction can look like. So you get to the hospital, they have a time where you come in for an induction, and you go into the hospital and they hook you up. They will get you on the monitors, get your blood work, do all the things. If you want an epidural, they will also take your blood for platelets, because they need to know what your platelets are looking like in order to be able to get the epidural. The platelets are how you clot your blood, so it's very important that you have really good platelets and not low platelets if you want an epidural. So that's one thing that they do. So they get you all hooked up and everything, and then they are going to see what your cervix looks like. Usually this is not really one that you can like truly decline. I mean, you can decline anything in labor, but you're gonna have a really, really hard time and like a big pushback with it, because they need to know like what kinds of things are going on with your cervix. Is your cervix really soft? Is it firm? They need to know these things. So they need to know if they need to do a softening agent. These are things like Cervidil, all those kinds of things. And essentially what these do is they just soften your cervix. Having really, really, really hard contractions against a very firm and hard cervix can cause distress to not only you, but also your baby. And so they really want you to have a soft cervix going into it. They want it to be like butter. So a soft cervix makes me so happy. And so that is one thing that they will start out with. And then they might change to the balloon. The balloon is a big balloon that they just put into your cervix. Then there's like a little balloon on the inside and the outside, sometimes, most of the time. But there is 2 balloons that go on the inside of your cervix and the outside of your cervix, and they put pressure on that cervix to help dilate you and efface you. So that is also what that does as well. That balloon will then get you to about 4 centimeters dilated, and once you hit 4 centimeters, it will kind of fall out. There's like a little catheter that it's like a little tubing that is on the end of it that they tape to your leg, and every little bit they come in to essentially pull it down so that your cervix dilates. And yes, a lot of people say that this does hurt, so just be aware of that as well. But once you hit 4 centimeters, it falls out, and then you can most likely, if you are not already having contractions or not having strong contractions, they will then go in with Pitocin. Pitocin is the synthetic form of oxytocin, and oxytocin is needed in order to have contractions. That is what causes contractions, is your body's natural hormones. But sometimes it doesn't always work that way, and we need the synthetic hormone. So that is what Pitocin is. I know Pitocin, I know a lot of people are like cringing right now at the word Pitocin. It has been vilified so much, and it can be great and it can be not so great at the same time. Pitocin contractions can hurt a lot more than regular contractions, so just be aware of that. But yeah, that is one thing that I know a lot of people are terrified of. They are terrified of the Pitocin, and rightfully so. I mean, it is kind of a scary thing to go through an induction, and especially hearing about all of these horror stories with Pitocin. But if you have the right provider, and a provider that is willing to take their time with an induction, go into an induction assuming that the induction will take about 3 days. Go into it knowing that, because I don't know about you, but when someone is trying to convince me to do something that I don't want to do and I'm not ready to do, it's going to take me some time. So just go into it knowing that it could take a few days, and just having a provider that is willing to sit there and wait those few days with you and not rush you to a C-section unnecessarily. There is also this really cool thing called a peanut ball. I'm sure a lot of you have heard of it or have used it. A peanut ball is essentially, it says in the title, it's a peanut shaped ball that goes between your legs, and it helps the baby engage in your pelvis, and it can help you dilate. This thing we call the dilation maker. And I'm not kidding. That's what we call it. It is magic. It's like a little magic bean. It's a magic peanut, and we love it so much. But yes, it can cause, of course, more painful contractions because it is essentially doing what it's supposed to do, and it's dilating you and getting your baby into the right position and getting your baby into the pelvis. And there's so many different positions that you can use with a peanut ball, and I will actually do a entire series over on my TikTok of all of the things that you can do with a peanut ball, so watch out for that. But the peanut ball is great because you can use that to help your labor along, and most of the time you use it in the hospital, and it can help you dilate and help your baby to engage into your pelvis. And so that's also another induction technique that you can do in the hospital. So now that we know what induction techniques you can use and what an induction looks like, let's talk about the whole nitty-gritty of your doctor wanting you to be induced. Electively, let's discuss this one because I'm not going to touch on medically. That's between you and your doctor, and you know your medical history. But let's talk about elective inductions at 39 weeks. So 39 weeks is full term, and that is why inductions electively cannot be done until 39 weeks. But I know a lot of doctors will push patients to have elective inductions. There's a lot of reasons why this can happen, and none of them are good. I'm just going to be honest with you. None of them are good. I've heard from so many people that their doctors are like, oh, there's a big holiday where my due date is, so let's induce before so I don't have to be called in on that holiday. And that is, first of all, just like very... I don't even know. It's not okay. And I hate it so much. I hate it so much because patients feel like, oh, my doctor is pushing me into this induction that I don't want. And that's when a lot of unnecessary interventions happen, is because if you don't feel ready, then your body also doesn't feel ready. And so when you're being pushed into an induction and your body also doesn't want to feel ready to do it, it can cause unnecessary C-sections and medical interventions where your body just doesn't want to do it, you don't want to do it, and you're being pushed into it. And that is not okay. You always, always, always have the right to say, no, I will not be doing that. No, I will not be doing that. You can even, if your doctor is really pushing you into an induction, you can schedule that induction and then cancel that induction, but just make sure that you have enough time to give the hospital staff that time. So if you are planning on canceling that induction, you can do that, but you have the right to say no. You have the right to say no to an induction, to anything that you want, as long as you know the risks. You must know the risks and the benefits of doing so. And usually for an elective induction, there's no medical reason to do it, unless you hit 42 weeks. At 42 weeks, yes, the risk of stillbirth does increase, but it doesn't increase exponentially like a lot of people try to scare you into. It really doesn't, but it does increase just ever so slightly. So, and that is because the placenta does age. The placenta essentially has a death time. I mean, I'm just gonna be blunt. It really does. The placenta does start to age. After 40 weeks, it starts to age. And so after 42 weeks, you kind of run into a problem of, oh, is my baby okay? You know, kind of things like that. So they might also do weekly NSTs, which is non-stress test. They will hook your baby up to monitors, do your contractions, monitor your baby's heart rate and their kicks, all those kinds of things to make sure that your baby is doing okay. But yeah, I think they actually do that after you hit 40 weeks or 41 weeks. It really depends on your office, all those kinds of things. So, but you can say no to an induction if you do not want an induction. It is okay. So this is where I'm going to leave you on this episode of Best of Birth Worlds. Oh, it's been a long day. I have had a rough day today. I'm not going to be honest. It was very hard filming this podcast tonight. So I'm very sorry that it's a short podcast, but I hope that kind of answered some of your guys' questions. Go over to my Instagram. I'm going to do a Q&A over there about inductions, elective, all those kinds of things. And I hope you guys enjoyed this podcast. I am Kayla, and I am your birth doula at your cervix. Bye, guys.